right, it's 9:06 a.m. 5.2, consideration of update on COVID-19. And I see that we have Dr. Pace with us. Dr. Pace, the floor is yours.
Thank you. Good morning, Mr. Chair and supervisors. This is an update on the COVID response in the county. I'm going to try to make this brief and focus on the vaccines mainly, which is what there's a lot of interest in. Just for a brief update of where the county's at, we're continuing to have widespread transmission. I'm not going to show slides today just because it's continuing on the same arc as it was the previous weeks. We have a higher number of cases last week than we've ever had before. And this week we're on pace to do the same. It's widespread throughout the whole county. It's in all the various parts, multiple businesses, different locations. Both the hospitals are pretty well full and are working at trying to accommodate as best they can. To give a picture of the state right now, the state actually is starting to look better. The curve is starting to flatten out in both the new cases and the hospitalizations. The death rate continues to rise, but overall it seems like the surge from Christmas and New Year's may not be as bad as we were initially concerned about. We're not seeing that same response in Lake County, and partly that may be because we are more rural and tend to lag behind the other parts of the state, but it also may be because we're in the Rancho region, which is not as closed down as much as the rest of the state. So this may be partly a result of the fact that there have been fewer restrictions over the last month or so. So we'll have to see. Hopefully we start seeing turning the corner here in the next week or two. That's what we're hoping. But I think right now we are in some of the hardest part that we're going to be seeing. We are, like I said, the hospitals are in the region, continue to be pretty full. In the Bay Area and in Sacramento, they're down under around 10%. The Rancho ICU capacity is still around 30%. So we're still above, but that's just not that very many beds. And most of our transfers go down into the Bay Area and Sacramento. So the hospitals are having some trouble getting people out, but over the weekend, there's been kind of a constant kind of working and extra efforts to get people in. We've got something like 15 plus COVID positive people just in the local hospitals, and that doesn't even include the people that have been transferred out. And so, there's just, we're in this kind of tipping point where we've been for a week or two, and the hospitals are working hard to keep things going and managing. And so far we're able to keep our heads above water, and with a lot of effort and work with the EMSs and kind of coordination with that. So far so good. The main thing I want to talk about today was the vaccine rollout. This has, been started about a month ago. We first got vaccines in the county. We're working a lot on planning, and we're going to expand the planning. We are going to try to sort of enhance some of the coordination and planning around that. I think we're going to try to get some contracted people in to help us do some of that work so that we can broaden our approach to how we're going after things. But what we've been doing here locally is working to set up some stand-up clinics. We have been doing that on a small scale. Today is the first day of the new kind of more ongoing stand-up clinics where we can expand to accept more people. That starts today, like I said, and we're moving forward. The main issue here is the limits of the amount of vaccine that's coming into the county. We are getting about 400 doses per week. We're getting 300 this coming week is the allocation. We're asking for more, and if more is available, we will get it. We're prepared to deal with it now. The problem is the state doesn't seem to be getting it. They don't know when they're going to get it, and it's kind of week by week we're trying to move forward. The tier system is how we're trying to prioritize people, so that since there's so little vaccine, we're trying to get to the most vulnerable people first, or the people that are most kind of impacted by COVID exposure, whether kind of EMS and hospital workers, things like that. So we're trying to focus on that and get to the right people at the front of the line since there's so little coming in. Very frustrating for the public, I know, and it's very difficult to manage this because there's thousands and thousands of people that want it, and we only have a few hundred doses. Recently, you may have read that Moderna had one of the lots. There was some question about one of these lots that was out, and Lake County had gotten one of those lots. None of that had been opened yet, so none of it is out in the community. But we now have 400 doses that we're not able to use while they're trying to figure out whether those are safe or not. So that takes 400 additional doses off the table that when we don't have that many to start out with. We still have enough for today's clinic. We're expecting a shipment in today, but this is kind of the way it goes. It's sort of day by day, step by step. We're trying to, basically our goal is to get the amount of vaccine that we get each week to get it out in the same week, within 7 days before we get our next shipment. The plan here is to set up the standalone clinic and to do some appointments through there. We're trying to control it with appointments, and we're focusing now on the elders, 65 and older, and the teachers and school staff. And we're really hoping to get the people 65 and older that are the most vulnerable, the most fragile, not the healthy folks that are active and able to avoid the virus and everything. We're trying to focus on the folks that are the most vulnerable, that are the most likely to die if they get this. And so we asked the senior centers to reach out to the people they knew to do that. And we filled the appointments for this week through that way. I think it's been frustrating. The senior centers are understaffed and overworked already. But we appreciate the fact that they were part of the way to identify the most vulnerable folks and get them in, since they know them through the Meals on Wheels and other ways. Folks 65 and older can also access appointments through their medical providers, especially Southern Adventist. They have their own streams of vaccine coming in. And so through those clinics, they're setting up some vaccine sites as well. And they're going to be doing quite a bit this week. The pharmacies are also starting to move into this. They're not getting vaccine yet, but we are trying to make arrangements with them. So the idea here is that we're going to be really trying to have multiple places throughout the county where people can access the vaccine. And so if the hospitals are able to get more vaccine, then they'll be the ones that are giving it. If we're getting it more, we'll probably either work through our stand-up clinics and or share with the other partners. We have shared some with Lakeview Clinic and Lake County Tribal Health so that they can get their older patients vaccinated as well. So, the idea here is to get as much vaccine into the county as we possibly can and to spread it out amongst the different clinical partners so that people can have access through different ways. The teachers and the school staff are able to they will be contacted by their school districts to set up appointments. We're basically allocating a certain number of appointments to the senior centers and a certain number of appointments to the school districts so that we can just start walking through whatever vaccine we have and getting these folks vaccinated. Once we get to a stable state, or once we get more vaccine coming in, then we will be able to open to the rest of the folks in Tier 1B, the first level, which is childcare workers and food and ag workers and other emergency workers that haven't already been vaccinated. But those folks we're kind of putting on the back burner for now while we're getting these things set up and getting these what we're considering higher priority folks to get vaccinated. I mean, the state and the federal government are the ones who are really giving us the guidance around these things. They've had big working groups working on this, but ultimately in Lake County, I'm the one that's making the decision. And so I'm sure people disagree with some of the ways we're prioritizing, or they don't understand why one group's ahead of another group. But, it's very difficult when there's such a small amount of vaccine and such a high demand, and people want it right now. They don't really want to wait a month, which is very understandable. And I really wish we could vaccinate everybody. That's my goal here, is everybody that wants it should be able to get it, but we can only do so much with the amount that we have. So So we're going to be doing these stand-up clinics that are going to be running 6 days a week, 3 days in Lakeport, 3 days in Clear Lake. We're going to be working with the community partners, and especially Southern Adventists are getting a good supply of vaccines, so they're moving forward quickly. We're probably going to be eventually setting up some mobile vans, some mobile vaccination sites where we can go out to basically potentially to employers or to, growers, agricultural folks, to try to meet certain groups like that. So we don't have the staff right now to do that, and we're just in the process of setting up these stand-up clinics this week, but that's ultimately where we hope to go with this. And then if we get a bunch of vaccine, we're going to set up some mass vaccination sites. If people are familiar with the Heroes of Health and Safety flu clinics that have been done annually for a few years here, they've been very successful, and they get 500 to 1,000 people done in a day. And we're starting to do some planning with the same folks that have set that up to possibly have that. But again, we're basically just trying to prepare for when the vaccine comes. Initially, we were thinking that maybe after the new administration comes in Washington, we would see more, but now it's a little bit unclear because it sounds like there's not as much vaccine at the federal level as we thought. So again, it's we're trying to do these multiple plans, multiple ways to get things out, and once the vaccine comes.
Did he freeze on everybody, or did he just freeze for you?
Yeah.
No, it froze on everyone.
It froze on me.
So hopefully we'll get him back in a moment.
But I had questions.
Well, and that's why hopefully we'll get him back.
No, hopefully, I'm sure he'll be back. If not, he'll have to reboot and start over. Hopefully he didn't lose electricity over at where he is at this moment in time. Okay, let me see here.
Maybe just take a 5-minute break or see if we can get him back.
Or we could move on to the 9:15 item and then just stop when he comes back in.
I'm thinking let's go ahead and give him a couple of minutes. That way we don't have to have an interjection within the conversation we were just having, because it's kind of distracting to start talking about something else when this is a very important topic. But if he's not back in 2, let's go ahead and move on.
Okay, he is just now telling me he does have power problems at his home, but he is dialing in.
Okay. So there's no need for a break. We'll go ahead and just be patient.
Jake, if you'll watch for a phone number coming in.
Yeah, that wind last night and still this morning as well was pretty outlandish. Glad it's not September or October.
Yeah, it was windy everywhere. Well, at 8.
It started to.
Yeah.
So I have 920 that just came through, and it looks like we're still waiting for Dr. Pace. So let's go ahead and I know Nanette is typically Dr. Pace. I believe that's one of the names that I've seen him pop up as. There we go. Let's unmute him. Oop, sorry. I think you were unmuted and I muted you.
Sorry about that. I think these winds are messing with the power.
100%, and your internet probably too.
Yeah. So I was talking about the mass vax sites and everything that we're working on to try to get things up and to get the appointments going. So, I think this is an iterative process. Things are changing all the time. If it's not the best solution to work through the senior centers, then we'll have to try something else. But what I'm trying to do here is to control the expectations so we don't have 10,000 people thinking they're going to be able to get vaccines this week and we only have 400 doses. So we're trying to control that with appointments and with kind of being as clear and transparent as possible. And I know it's extremely frustrating for people, and I'm not sure how to fix that until we get more vaccine. Like I said, the childcare workers, food and ag workers are going to be soon. How soon just depends on how much vaccine comes in, and so I can't really give a timeline. And then the next groups will be after that. So we're just going to kind of walk through this in as reasonable a fashion as possible. I think probably the best place to try to get information is on our website. We're trying to update that as quickly as we can, but it's changing quickly every day, you know. So we're trying to coordinate these through different groups. So, for example, the farm workers, I'm meeting with some of the growers this afternoon to try to set up a plan for that. So we're trying to stay a little bit ahead of it, but you know, there's a lot going on. So really, I mean, I just want to say a few basic points and then we'll open it up to you all. But one of the aim is to get as much vaccine as we can. But we're having a lot of trouble with that, and as is everybody. You know, this is one of the big problems here is each county is trying to scramble and sort of compete and get in front of the other one to get vaccine, whereas if there was a more coherent strategy to rolling it out, it would be better. What they've done in California now is they have an equation and an allotment that they give to each county. Last week, they sort of figured out on Tuesday or Wednesday that there were some pockets of vaccine that weren't being well used. That's not the case in our county, but I think they found some, and then they quickly said, can you use this by Friday? And if you can, we'll give you some. And we weren't prepared to do that. We were starting to prepare for this week. And so some other counties did get some vaccine at that time. Now we're ready. So anything that can come, we're ready to deal with it. And so we've let them know that, and hopefully we'll get to see some more. So the first one is we're aiming to get as much vaccine as we can. The second is we're basically trying to use up what we get every week. So we're not keeping it around. We're not saving it. We are trying to save some for second doses. It's unclear just how the second dose supply is going to be coming in. And so we're trying to kind of keep that in our back pocket so we're able to cover people with their second dose. But essentially, we're not stockpiling. We're not trying to prepare for something down the road. We're just trying to move it through. The third thing is we're trying to prioritize people in a reasonable way and in a transparent way. We're trying to let people know what's going on as best we can. And not everybody's going to agree with my choices. And, you know, my inbox is filled every day with people trying to trying to advocate for people in their office or in their family why they should be at the front of the line. And, you know, we're just trying to set up these large sites right now and trying to get this out into the community as best as possible. And so, you know, that's basically where the whole vaccine situation is going to be changing. It'll be a completely different discussion next week, probably. But we are hoping to get this structure in place with these stand-up sites. And this is going to be the main place where the ones that we get through the health department can funnel through to get out to the community. So all in all, I think, you know, right now we're probably at the most challenging place that we are going to be in the pandemic. This whatever 2 to 4 weeks we're in right now we're there. The surge is happening. We're managing it, but the cases are still rising in Lake County, which means the hospitalizations will be rising for a couple of weeks at least. And the vaccine is not, you know, a very low number of people in the county are vaccinated so far, something between 1,500 and 2,000 probably. And the more people we can get vaccinated and the less people we can get sick and transmitting the virus, the better off it's going to be. So just really encourage everybody for the next couple of weeks to lay low as much as you can and try to have as little socializing contact and as little public contact as possible. So I think that's it now. Thank you.
Thank you, Dr. Pace, for that update. Supervisor Scott.
Good morning, Dr. Pace. Thank you for you and your team taking on this challenge of vaccinating our community. I just have a couple questions for you. Do we have any idea how many doses Sutter and Adventist are receiving? And are they using the same strategy that you're using with vaccinating, making sure that they're following your guidelines, or are they coming up with their own rules on who's going to get vaccinated?
So we're in communication with both Southern Adventist and the clinics. And so we're all working together and trying to generally stay aligned with who's getting it. They are getting the vaccine through their corporate structure. So the Adventist corporate and the Sutter corporate get some allocation from the state. We're not really privy to that. And then the local folks ask them for certain amounts, and we're encouraging them to get as much as they can to come in. And but that's sort of in their chain. I don't have that information. And but like I say, they've been very cooperative, and we're all working together to try to get this out there. The goal's the same, and there's not really competition. It's all just like, let's just get this out as best we can. And they're both really working it up through their clinics and through some stand-up clinics, I believe it looks like what's going on.
Okay. And then I received a call over the weekend, somebody that fits in the 65 to 75 age group, and they called the senior center, and the senior center told them that they're only taking appointments for 75 and up. And they tried to explain that, no, Dr. Pace said 65. Could the senior centers be trying to do their own priority, trying to get older ones? Or
sorry, yeah, that's the whole point of working with the senior centers, was that I really was asking them to look at the people they knew and try to prioritize the most vulnerable people first. So I was really, however they did that, it was really about trying to get the people at the front of the line that are the most vulnerable, and to asking, because somebody that's 66 and just comes off the tennis court, they qualify, but they are not really the ones we want to target when we only have a very limited number. We want to target, the older folks that are very vulnerable and don't have a whole lot of ability to work this. So it's so the senior centers were doing exactly what I asked them to do if they did that. However they prioritize that, we only had really 250, 300 slots for the senior centers to use. And you can imagine there's thousands of people in the county that are in the 65 and over range. And in my experience, usually the folks that are the healthiest are the ones that are able to advocate most strongly. And so that's why we really are asking people not to call the senior centers, because they're getting overwhelmed. Their phone machines are full. They can't even get to calling the people that they're trying to call because the phones are just ringing off the hooks. The people that really need this kind of attention and help are the ones that we want the senior center, basically the folks Meals on Wheels and those kind of folks that are the ones that are the most vulnerable. So it's complicated, and it's going to be frustrating, and it's very imperfect, but I'm not sure a better way to do it right now. I think most folks 65 and older have a doctor, and they probably the best way to do is to try to go through your medical provider, and then let the senior centers really target the ones that are the most vulnerable.
I thank you, Dr. Pace, for that. I think people are just under the idea that it's going to be first come, first serve. When a section is open, it's going to be who can get to the phone and get that appointment. But I do believe, I think you're right. We need to make sure that we're taking care of our most vulnerable and then working our way down. It's not going to be who can advocate for themselves the best in that group. So again, thank you, Dr. Pace.
Thank you.
Thank you, Supervisor. Any others have a question or comment? Supervisor Pyska?
I have a couple of questions. When I was in a few meetings last week, I heard some interpretations of the data that you've been presenting at these board meetings that wasn't, I felt, very accurate of what our current situation is. Basically, they were thinking because the state is seeing a decline in cases possibly, that we are too. And I was urging them to come at least find the section in the video of these meetings to see the slides and to really hear the presentation. So I was wondering if you could put some of the slides. I mean, I react best to seeing graphs. And when I see the bar graphs go up, you know, it really brings home what's happening rather than just seeing the numbers. So I'm wondering if you could do a presentation or a quick video with Sarah's slides that could show the public easily what you're showing us in the board meetings.
So are you asking me to do that now, or in the kind of do a Facebook thing and put it out in the public? Okay, sure.
Yeah. And then when the data is updated on Facebook, you know, the graph is on our website, but it's not showing up in the on the Facebook page for the county. And I think that visual might be more impactful as well.
Okay, good idea.
And then, so seniors that are not associated with the senior centers and don't have doctors in the area, what's the best course of action for them? Even 75 and older, what would you suggest? Do they call public health or?
Well, again, we don't have any extra appointments right now. I think, you know, I don't have a good solution for that today. You know, hopefully when we get more vaccine, we'll be able to do it. Or, you know, if this goes on this way, I'm kind of hoping the vaccine supply is going to open up significantly and we're going to be able to say, okay, come on in if you're 65 and older. That's kind of what I'm trying to drag my feet, because I think that's coming in the next week or two, but we don't know. They're not really telling us. So right now we just don't have enough appointments for everybody. If there's somebody that, you know, yeah, so we're working on that. I think it's going to be a week or two before we get a good solution for that. Hopefully the pharmacies are going to start being able to vaccinate people, and that's going to be a way where nobody needs to be a patient or anything. They can just go.
Great. And so my last question is about kind of monitoring the vaccinated population in our county. And you said it's about 1,500 to 2,000 right now, but are we going to be tracking that publicly so people have a sense of how much of our population's been vaccinated?
Yeah, the problem, we're working on that. We're trying to get it together. We'll be able to do the health department numbers, and it's a little harder getting it from the other places. And so, but yeah, I would like to say, let me try this. Let's say by next week, I'll at least give you a report one way or another, because it's something I know the public wants, and it's a very fair question to ask. And we're working on how to do that. It's just, we've been really focusing on getting these testing sites up this week, and that seemed the most important thing, so that we could absorb whatever vaccine is available. We wanted to have a platform to be able to put that out. So I think that's a good point, is getting the data, and probably trying to get it on the website. Is that what you were thinking? Yeah.
Yeah.
And I see Ms. Hutchinson has a comment on this.
I just have one more thing.
Well, this is in response to one of the questions you asked, if that's okay. We do have the video of Dr. Pace's reports to the board meetings, and which includes the slides. And we have that excerpted, and can make that available anywhere you'd like it available, and save him the trouble of re-recording.
That would be great. Yeah.
Thanks.
Well, the last thing I wanted to say is that I'm just really appreciative of all of the work that you put into getting these clinics, these vaccination clinics up and going. And I'm going to go volunteer today so I can see for myself how it's going to be unrolling. And I think my Nana got an appointment, so I get to see her come through today too. So thank you.
Anyone else have any comments? Supervisor Crandall?
Yes, just wanted to, say the same thing that Supervisor Scott had mentioned about the vaccinations for the 65 to 75. That confusion. I've talked to different folks this last week, and when I started giving them like the report that you gave, they were like, "Well, we already called, and they said they're not doing it for 65 and older." And so I says, "We're still waiting." I explained that we're still waiting on the state to give you the information on when we're getting more vaccinations. So I try to stay to that. And I also try to let people know that based on the state's information as well, into the vaccination sites will be in Lakeport and Clear Lake. And I actually got to witness the one in Lakeport. It was over at the fireplace or something like that in Lakeport. A lot of people there. I had to go there for a rapid COVID test for somebody, and so I was able to see how they were doing that in action. It was a really good thing to see. And so I just wanted to touch base on that to ensure that we can get some information out. And I'm pretty sure that you're pretty much going to do it so that I can ensure that some of these folks don't have that confusion any longer about the vaccination. OptumServe, I've been giving people that information as well. So that's, I don't really have anything else, just that.
Thank you, Supervisor.
Can I just say one thing? I just want to, you made me think of one thing. I just want to, I think the comment about people thinking it's first come, first serve is really important, because it's really not that. And we're trying to discourage that, because what we're really trying to do is get the most vulnerable people in first. And then Supervisor Crandall mentioned that, and it reminds me, just please don't show up at the vaccination site if you don't have an appointment. We will not be slipping people in or seeing if there's an extra dose. If you come in and you don't have an appointment, we're going to turn you away, mainly just so that we don't have kind of mass, people kind of crashing the sites trying to get things. We've seen that at other parts around the country, and that's why we're really trying to focus on using appointments so that we can help the folks get in that really should be at the front of the line. So thanks.
Yeah, thank you for covering that too, because I also get the people start stating things like, I want to get the vaccination so I can go visit my family. I think some folks have this notion that they can get the vaccination and they're clear. So maybe elaborate on that, that it might take some time. I know that's another thing as well. And so.
Right. So I think a couple points there are really important. The vaccine is 2 doses. The Moderna is 4 weeks apart. So you get the first one, say you get the first one today, within about 10 days, you'll probably be about 80% protected. And then after the second dose, which is in a month, another 7 to 10 days after that, you'll probably be about 95% protected and at kind of maximum protection at that point moving forward. We don't really know how long it lasts, but it seems to last for at least many months. The other key point is that even if you get the vaccine is not live. So you're not going to get COVID. You're not going to spread COVID. You may get some symptoms, but that's your immune system responding to the protein. It's not the illness. So you don't have to worry about that. And then the other piece is that we really don't know yet whether you are contagious or not, whether you can still get the virus and be contagious even though you're not getting sick. So even people that get the vaccine, they can probably feel more free about being out and about and doing things, but they still need to wear their masks. They still need to social distance. And they need to know that if they go out to the store and are, socializing and everything, and then they go back home, it's possible that they're going to pick up the virus and be able to spread it to their family. So, these are just parts of it that may change. We may learn more in the future once the studies come out. But at this point, that's sort of the thinking, is that we need to be really careful still.
Thank you for that information. Anything else? Supervisor Scott?
Yeah, Dr. Pace, just would like to, thank you for the hard work that's being done. I know that, a couple of weeks ago, I had mentioned, and I think you mentioned something today just on staffing issues. And I know that, whether it's part-time help or other things like that, I would just like to encourage you to continue working with, obviously, Supervisor or Chair Sabatier, and looking at any issues that we may be able to help with support here from the Board of Supervisors. I think we've already made some changes this year with the budget, but just want to continue to say we understand that your most important workforce is bodies, and understand the challenge not only for us but the entire country right now to help roll this out. I just want to continue to advocate for that support if it's needed, and hopefully if you need something, please don't hesitate to work with our CAO and the chair to bring something to the board to help support you in that manner. I just want to make that very clear. But I understand also the challenges, just having the bodies to do it. Not a lot of folks want get out and volunteer or get involved at this point because how critical the fight is in the COVID-19 pandemic right now. But just, that's one of the points I want to just really reiterate to you today, and I'll keep doing it each week throughout this pandemic. Because we know how hard and how, thinly stretched your department is and everybody on the front lines that are helping with this. And this is the critical time, and I just, continue to support that conversation every week.
Thank you, Supervisor. Yeah, we've been moving along, and at the level we were working at before, we were able to maintain, and I think we're recognizing we're going to need more help and more support here for this, the scale of what's here now, especially in the middle of the surge. And so there's a lot of talk. We're working. I've been talking with Carol, and we're working around probably hiring some people to help really with the planning and the coordination of this more, so that we can have a bigger view and be dealing with some of the parts that we just aren't able to deal with well, just for lack of people. So we're actively working on that, and I really appreciate your support and willingness to do that. And we'll be back talking about that in the coming weeks for sure, because this is going to be a big, long-term rollout, I think, over months, and we'll need a lot of people and a lot of coordination to get these pieces in place in a good way. So thank you.
Okay, thank you, Supervisor, for those comments. I just have a few questions as well. First, I want to thank Supervisor Scott for bringing up the senior centers. I know that I spoke with the senior center over at Clear Lake Highlands. Definitely overwhelmed with phone calls. I think what's the trigger is the vaccine was a huge beam of light of hope. And as soon as they heard that the senior centers were getting involved, I think anybody who is a senior started thinking they could call the senior centers. But I agree with what Dr. Pace was saying, which is also what the senior centers are working on, which is to contact the people that they serve on a daily basis, on a weekly basis, based on the programs that provides extra help to those seniors, because those are our vulnerable seniors. I don't think, Dr. Pace, that there is a one way to make this rollout be perfect. I think everybody's going to be happy on one end and upset on the other, because it's not them that's at the front of the line. I think it's just about getting through it, which is the unfortunate situation, is getting through it also with unknowns. How long does this vaccine actually last? Does the vaccine lapse before we actually get to vaccinate all the people that want to be vaccinated? There's a lot of questions that are still out there that could create further difficulties for us. And so I think it's important that we make sure that we do this correctly. And I think that so far, the steps to obtain the clinics in both Lakeport and in Clear Lake are going to be helpful to making that possible. I know that I was part of some emails between yourself and the state. The numbers that were originally being talked about were small and looked like a very long-term process to get a very small amount of people vaccinated over the course of almost the next year. And those numbers changed drastically over the course of that email. And so I'm looking forward to hopefully getting those numbers to you, because that's the kind of impact that we're going to be looking for with this vaccination. 300 a week is just not enough. As far as we talked about Sutter and we talked about Adventist Health as well, doing their own vaccines. I know that Tribal Health has been doing vaccines for quite a while as well already. And I understand the potential issues possibly of having to share that information, but I'm going to ask if Dr. Pace, if you please say no if this is not helpful, but I'm going to ask for the state to provide those numbers directly to public health, because I think public health at each county level should be aware of what the population ratio of vaccination is in order to make sure that we adjust our game plan accordingly. So, and if we're not aware 100% as far as what Sutter of our pharmacies, then we're going to be kind of left in the dark as to what we really need to do to make sure that we get as many people vaccinated as possible. And I know that the state has that information, and so that they should be able to bring that back directly to you, so public health is well aware of those things. I want to talk real quick about the 400 vaccines that you said that were part of the lot that was a complaint from San Diego area. Are we returning those vaccines? Are we getting an exchange for those vaccines, or are those lost for us?
Well, all we know is we've gotten word from the state that they have some concerns. They're actually mild concerns. There's been hundreds of thousands of people that have gotten Moderna vaccine and done fine. So it looks like they had an increase, less than 10 people, but I think it was probably more than 5, between 5 and 10 people that had increased reactions down out of one clinic in San Diego, and they traced it back to one lot. So the state, basically out of an abundance of caution, said to hold using that lot. And one of our shipment last week was from that lot. So it's, we hadn't broken into it yet. So luckily it was still just intact. And what the current guidance from the state is to not use it while they figure out what to do with it. They'll have to figure out whether it's safe to move forward or not. And they've got their team on it and looking at it. So at this point, we're just holding on to it and waiting to see what happens. And they don't have any replacement.
I would love to see sooner than later. Right. And I'd like to see that be replaced sooner than later, because that's a loss for individual counties, which includes us, when we're already such a small allotment on a weekly basis already to begin with. For the rollouts with the tiers, it says food and agriculture. Does food cover grocery stores? Or is that meant to be food handlers outside of retail?
The way I understand that, and again, I haven't researched it deeply because we're not there yet, but the way I understand that it's essential workers that are both in the grocery stores and in the restaurant industry, because I think the idea is that these folks have to work. They don't have the option to go home. And if you think of the cashiers in the grocery store, I mean, they see a lot of people in close contact. So their risk is fairly significant. So my understanding is it's both. And so we want to get those folks vaccinated as soon as possible. It's just, who gets in front of the line. And yeah.
No, I agree with that diagnosis of what that says. The interpretation is the way that I interpret it as well. So I'm glad that you see it that way too. I think it's important that everybody goes grocery shopping at one point or another. Therefore, all the grocery store clerks and staff see basically all of our communities every single day. So good to have them on there. I did read a story this morning, which kind of gave me pause. And I just want to check in, and I don't know if we can prevent this. Are we only vaccinating Lake County residents with the dosages we are receiving for Lake County? I know a lot of people are I don't want to use the word desperate, but they really want to get protected by getting the vaccination, and they're starting to county hop to look for appointments to be made to get vaccinated. Are we asking people if they are Lake County residents? Are we allowed to make sure that they are Lake County residents? I really would like to see us possibly prioritize Lake County residents as being the ones receiving the vaccines being submitted to Lake County by the state and the federal government. Is that something that we're doing, or are we just looking at the basic guidelines of 65 but not locality?
Well, again, this is part of the strategy that we're using is through the health department, we're only giving it by appointment, and it's only by reaching out to people. So, for example, the only way to get an appointment at the Standup site right now is to be reached out through the school district or the senior centers, or that we're trying to track people that were previously in the 1A section that fell through the cracks in some way. So there's no way for anybody to call in to make an appointment at this point. That's not really available. Through Southern Adventist, they're working with their patients, and I'm not sure how they're screening that. But I suppose it's possible that somebody that works at one of the schools lives in a different county, but for them to be able to come back to work, that they're getting vaccinated by us, presumably. And so, but again, it's, you know, there's not really a way for somebody to call from Mendocino County and just say, I'm 65 and older, give me an appointment. That's not really available. That's partly, since our supply is so little, that's how we're trying to control it and make sure the right people get to the front of the line. It's kind of labor intensive, but it's how we're trying to manage it.
But eventually we will get to the appointment style once we get past and we go into just the essential work, which is going to be a very large group of people. Because the way that I see it is when we did the testing, eventually our testing, you couldn't get an appointment for testing for another 2 weeks because everybody from Napa, Sacramento, Sonoma County were all coming to us to get tested at one point because their testing was so far behind in appointments as well. And so by allowing the crossing over of counties, and again, I'm just looking to make sure that what we get as our supply, as much as possible in the long run, goes directly to our people.
I think, again, our strategy is like with the farm workers will be to try to work through the growers, and with the grocery stores to work through the employers, so that we give them a certain number of appointments to set up for their employees. I think that's what we're going to be trying to do, at least for a while, until we get a lot of vaccine. I think when we're in this very constrained amount of vaccine and the really high demand, we have to just control it, because otherwise, yeah, if people are coming in from out of the county and getting it, that's very problematic and very frustrating for everybody. So we're trying to prevent that from happening.
Okay. Appreciate the answers on those questions. Any other questions before I open it up to the public from the board?
No.
Okay. Jake, let's go ahead and open up the Zoom room, please, and let's see if anyone has any comments or questions to Dr. Pace on the status of COVID-19.
All right, I've sent an unmute request out to the Zoom room floor. If you'd like to make a comment, please unmute and state your first and last name.
Okay, hearing none, let's go ahead and bring it back to the board. And if no further discussions, which I don't see anybody's hand going up. Thank you, Dr. Pace, for the update. Thank you for all your work. Yeah, thank you very much.
Thank you.